Hey guys, this is Gokul on behalf of Group 6. The topic for today is gram-negative bacterial infections. It's a very vast spectrum to deal all here. So I'm going to battle with time and concise the most common causative organisms so all my buddies will have a brief touch about the topic. So the gram-negative bacteria, here we are going to break them into aerobes, facultative anaerobes and obligate anaerobes. So in the aerobes you have the Pseudomonas, Bordetella, Francisella, Brucella and Alcaligens. Of this, the Pseudomonas and Bordetella are the most predominant forms in the infants and children. So we are going to kick out Francisella, Brucella and Alcaligens with a bang. On facultative anaerobes, we have the lactose fermenters and the non-lactose fermenters. In the lactose fermenters, you have the Escherichia, Klebsiella, Citrobacter and Enterobacter. Of this again, the Escherichia and Klebsiella are the most common forms, while the Citrobacter and Enterobacter are the non-common forms which we are going to blast it out. In non-lactose fermenters, you have the oxidase negative and the oxidase positive. Of the oxidase negative, you have the Salmonella, Shigella, Proteus, Providentia, Morganella, Hafnia, Edwardiella, Serratia and Yersinia. In the oxidase positive, you have the Haemophilus and Pasteurella. Of these, the most common forms in children are the Shigella and Serratia. So, I'm going to blast all this with a heavy dynamite. The last comes the obligate anaerobes with bacteroids, which is the most least common form. So, I'm again going to kick this out. Now, let me show you some pictures and make you to guess what the bacteria it is. Okay, now look at this picture. See the green ring around this chap? You guess is it a fungus? No, definitely not. It's a Pseudomonas aeruginosa. If you put this in a petri dish plate and culture, you get a bluish green jelly-like containing the pyocyanin with a grape-like odor. They are resistant to soaps, dyes, quaternary ammonium salts, disinfectants, drugs, etc. So, we should know how strong they are in infection. Frequent contaminations from ventilators, nebulizers, anesthesia equipments make the infants more susceptible to Pseudomonas, meaning they act as opportunistic pathogens when the child is immunocompromised. Main complications in children leads to pneumonia. Now, what disease you will think if you see this picture of a baby with a whooping cough? Yes, it is Bordetella pertussis. It's a minute encapsulated coccobacillus, a communicable childhood infection causing acute respiratory syndrome. It often causes severe life-threatening complication in babies. On seeing this picture, you will definitely conclude it's a E. coli. Yes it is. There are more than 150 strains in this bacteria. So, why am I speaking about the E. coli here? As because 4 different strains mainly cause diarrhea, and out of which it is the enteropathogenic E. coli that is linked to the wasting form infantile diarrhea, where babies cannot replenish their fluids and results in wasting. Infantile diarrhea is the greatest cause of mortality among babies. Now, what can you think of on seeing this picture of a bacterial culture in a McConkey agar? Last year in microbiology, you would have learnt about the mucoid appearance, is it? And that's true, it's your Klebsiella. These are the normal inhabitant of the respiratory tract in the infants and children, but nosocomial infections will lead to Klebsiella pneumoniae. Nice red beaded appearance, right? Any guesses? Well, it's your Serratia marcescens, and the red pigment here is due to your prodigiosin. Also, it mainly causes pneumonia. They are commonly found in bathtubs and faucets and easily attack the children when they are immunodeficient. And at last, why this mother is more concerned about her child hands and keeps it washing? Your deep thinking may land onto shigellosis, especially causing Shigella gastroenteritis in infants and toddlers. Initially with watery stools and later ending on with bloody stools. Nasty organism, right? Now why I discuss especially these organisms, because these are the most common ones in the gram-negative bacterial infections among children. I would like to go more on the flow, but the clock is ticking over my head, transferring the discussion into a further role play by our members. Please wait.